The ambulances were procured under the Government Infrastructure for Poverty Eradication Programme (IPEP), currently being implemented by the Ministry of Special Development Initiatives. The ambulances are fitted with digitised ICT system, tracking devices and labeled. To ensure the maintenance of the ambulances, the Ghana Ambulance Service has signed a 5-year service and maintenance agreement with the suppliers to ensure its servicing and maintenance. 450 medical technicians, EMT drivers out of the 575 who were cleared for recruitment have been trained, with over 300 EMT drivers and support staff and 30 dispatchers posted to the 275 constituencies nationwide. In addition to the 307 ambulances, clearance has been given for 575 EMTs to be recruited, out of which 450 have been recruited, with an additional 900 staff who have received clearance also to be recruited.
These ambulances have been equipped with state-of-the-art advanced life support devices, including all the must-haves in an ambulance, in order to facilitate a quick and comfortable transfer of patients. It has stretchers, first aid kits, oxygen cylinders, spinal immobilization devices, portable ventilators, both adult and fetal monitors, automated external defibrillators, and many others. The Emergency Medical Service System, and for that matter, the National Ambulance Service of Ghana, is dedicated to providing out-of-hospital acute medical care, transport to definitive care, and other medical transport to patients with illnesses and injuries which prevent the patients from transporting themselves. This year, 2020, the National Ambulance Service will add 145 new stations, the highest in our country's history at a time, increase the number to 275 stations.
Health Minister Akufo-Addo assured of government support for the National Ambulance Service.
All efforts are going to be made to continuously support the National Ambulance Service to improve on quality of pre-hospital emergency care services. We are not just providing ambulances, but we are building a holistic emergency response system.
President Akufo-Addo noted the expectation of government for the ambulance service to maintain the investment to ensure longevity. He also noted his expectation for the ambulances to be put in good use to serve Ghanaians and add to ongoing efforts by his government to secure livelihoods.
Government is committed to ensuring the realization of an effective emergency medical service EMS system to help improve our country's emergency response capabilities. The National Ambulance Service Bill, which identifies funding sources for the National Ambulance Service, is currently before Cabinet. This will be forwarded to Parliament for consideration and enactment after Cabinet approval, which should be granted shortly. Government is providing a digitized state-of-the-art ambulance dispatch management system integrated with the National Digital Property Addressing System, whereby all calls to the ambulance service will be routed through a computer system which will automatically generate the digital address location of the caller to enable the control center determine straight away the nearest ambulance to dispatch. It will also allow the ambulance to determine easily the nearest healthcare facility suitable for the emergency. This system will also allow the ambulance, when dispatched, to navigate without difficulty using the dispatch system in the ambulance straight to the location of the caller. Government will ensure that the needed infrastructure is provided to the paramedic and emergency care training school at Nkenkaso to help ensure that it serves its purpose of training paramedics in the country and West Africa.
A national emergency number 112 was also commissioned to be used for all emergency services in the country. The ambulances have since been dispatched to their respective regions and then to the various constituencies. Adele Kwesi Machdu reporting for Metro News.